that we are doing right now, ability to express one's thoughts and emotions by speech, sounds, and gestures. Today we are only focused on speech only, not on gestures. Main stages of human speech include phonation, articulation, resonance, and of course, there is an imminent neurological network that provides its control over all these processes. We'll talk about all these processes one by one. First of all, we'll talk about phonation. Phonation is the production of basic vowel tone in the larynx. Laryngeal function determines the process of phonation. So larynx is the main organ involved in this process of phonation. As far as articulation is concerned, during articulation, new sounds are created and modified with the help of articulators. And what are articulators? There are two types: active articulators and passive articulators. When you talk about active articulators, these are lips, tongue, soft palate, and pharynx. The passive articulators are teeth, alveolar ridge, hard palate, and uvula. And you will see if you closely observe a singer singing a song, you will see the faces that they make in order to create the sound and the tones. Resonance occurs within the oropharyngeal nasal cavities and paranasal sinuses, gives characteristic quality to the sound. आपने ऑब्जर्व किया होगा जैसे आजकल ये कोरोना में कॉमन कोल्ड फ्लू की सिम्टम्स भी आती हैं. So after a common cold or a flu, you will see the quality of sound changes because of the filling of mucus in the paranasal sinusitis, a condition we call sinusitis. So the quality of sound changes. It's a common observation. So resonance is basically made by the oropharyngeal nasal cavities and paranasal sinuses. Then, of course, neurological control determines the arrangement of sounds to form a pattern of communication. The basic actuators are there, active and passive. We have this sound box that is larynx. But when it comes to pattern of communications, the neurological control is eminently important to make us enable to say what we want to say. So this is coming from the neurological control.
No.
Yes. Physical parts.
सॉरी डॉक्टर हफीज, आप सॉरी फॉर इंटरप्ट यू, आप प्लीज सबको म्यूट ऑल कर दें.
सर आप खुद भी म्यूट हैं.
डॉक्टर हफीज अपने आप को अनम्यूट करें.
Hello. Hello. Hello, students, can you hear me?
Yes, sir, we can hear you now.
Okay. How much you have followed me? मालूम है काशी बिहार ये उसने होस्ट ने मुझे वो म्यूट किया, वहां से ना पीछे एक दो स्लाइडें रह गई. उसको वो भाई बी केयरफुल, वकास को बोलो ना. Okay. Okay बेटा, can you hear me? Hello.
Yes sir.
Okay, good. चल अब अच्छा कहाँ से आप लोगों ने लॉस किया था यार, मुझे नहीं पता, मैं कब से म्यूट था. Okay. Let's talk about the physical parts of the vocal system, little bit anatomy, physiological anatomy, so that we can understand the process of speech, there are three main anatomical aspects. As we said, there are actuators, which involve lungs, diaphragm, intercostal muscles, and these organs deal with breathing and air management. So actuator में क्या हो रहा है? There is, देखो अभी तक तो हमें lungs का यही function पता था कि we take in some oxygen, we get rid of some carbon dioxide, there is breathing in and there is breathing out. लेकिन अब हमें एक चीज और पता चल रही है, as the air gushes in and as the air leaves, that will enable us through the actuators to make sounds, to create sounds. And the actuators are lungs, diaphragm, intercostal muscles. And they are basically concerned with air management. अगर सिंगर को हम देखें सिंगिंग करते हुए तो आप देखो कि बहुत लंबी सांस ले लेगा, फिर उसको निकालेगा, तो he is doing that air management through the actuators. और actuators क्या हैं? Lungs, diaphragms, intercostal muscles. Vibrator क्या है जी? Vibrator is basically the larynx or the sound box, and this sound box, with the help of vocal cord attached to it, can set in some vibrations and which can form a sound wave. So the vibrator is basically is larynx. It's also called voice box or the sound box. Resonators, throat, pharynx, mouth, lips, teeth, nose, these deal with the modification of sound into tones of varying colors. It's called timbre. So this tone of various colors is called timbre, and the singers, they very effectively use the timbre to sing good sound, which might, good to hear. The actuators or the breathing process, as we said, you can see this diagram on the left is showing you the respiratory system right from the external ears till the diaphragm, and you can see the pharynx or the throat from where this is actually showing you all the passageways of the ears from the external ears to through the pharynx and the throat to the larynx to the trachea and then to the bronchi and the intercostal muscle and then to the lung, and outside you have the intercostal muscles, the ribs, the diaphragm, the pleural membranes, etc. So all these organs are part of, but the actuators are actually intercostal muscles. By the help of intercostal muscles, we can change the velocity and the frequency of the air that is coming in and going out with the help of diaphragm and also the lungs. The breathing process, actuators are organs used in the breathing process. Respiration, however, refers to the actual process of breathing, as I already said. It has two parts, inhalation and exhalations. And inhalation is done with the help of diaphragm, is the main muscle of respiration, whereas the intercostal muscles are involved in both inhalation and exhalation. We'll talk about that sometime later. Respiration is when breathing out or exhalation, the diaphragm and the intercostals relax, which makes the lungs force air back out, much like a bellows being squeezed together. So it's basically a passive process with the elastic recoil of the lungs and the movement of the diaphragm upwards, reducing the thoracic cavity to gush the air out of the lungs. अब ये एक बड़ी meaningful सी animation है. You can see on the extreme left, you can see the movement of diaphragm in inspiration and expiration. Note, in inspiration, the thoracic cavity increases in volume from superior to inferior. And during expiration, the exactly opposite occurs. But with the movement of the ribs, you can see the transverse diameter and the anterior-posterior diameter of the lung is increasing. That is seen with a diagram in the middle and the animation on the extreme right. Can you appreciate that? Hello? Okay.
Yes, sir.
Okay, good. Vibrator, also known as oscillator. Larynx is the formal name for voice box. Also, some people call it the Adam's apple. In slang, it's called Adam's apple. The larynx contains the vocal cord, also known as vocal folds. The epiglottis closes off the airways when swallowing, so food does not go down the windpipe. It has to be closed, and a brief period when we are swallowing, the tracheal opening is closed, and that is called deglutition apnea. just for a moment. The thyroid cartilage houses the larynx and protrudes into the neck, easily visible on many men as Adam's apple. Okay. ये हाइड बोन, एपिग्लॉटिस, थायराइड कार्टिलेज, ट्रैकिया, ट्रू वोकल कॉर्ड, ये सारे स्ट्रक्चर्स आपको इंटरकनेक्शन दिखाएं. आई थिंक यू हैव डन दैट वेरी वेल इन एनाटॉमी, तो इस पे हम ज़्यादा टाइम नहीं लगाएंगे. वी हैव लॉट ऑफ थिंग्स टू कवर इन टुडेज सेशन, तो हम उसकी फिर बात ज़्यादा करेंगे. ठीक है, तो बस लेफ्ट पे आप देख लो, लैरिंग्स एज यू लुक डायरेक्टली अहेड फ्रॉम अबव, और राइट पे जो डायग्राम है वो दिखा है लैरिंग्स इज लुकिंग डाउन द थ्रोट. तो when you pass laryngoscope, you can see what you see on the left, and when you go through a bronchoscope, you can see what you are seeing onto the right. और वो सारे structures I am sure anatomy वालों ने आपको बहुत अच्छे से करा दिए होंगे. Now let's come back to the business speech. So speech is basically an interplay of two mechanical functions. Number one, phonation, and number two is articulation. Phonation की जब बात आती है तो is due to creation of the sound by the sound box, larynx, with the help of vocal cords. And with this movement of the vocal cords, the vibrations are set into the larynx, which makes this phonation. And as far as articulation is concerned, it is achieved by the structures of the mouth. कौन कौन से हमने structures mouth में कौन कौन से structures की बात की थी? Active and passive actuators. ठीक है. Speech involves not only the respiratory system, but also it involves the specific speech nervous control, the cerebral cortex. Yes, this is what makes us make communication meaningful with the help of those nervous control centers in the cerebral cortex. Then there are respiratory control centers of the brains. Respiration आप लोगों ने की हुई है. Can anybody recall those respiratory control centers? DRG and VRG, dorsal respiratory group of neurons and the ventral respiratory group of neurons. We said there is movement of the air through those parts in the breathing, and there is creation of the sound by means of phonation, and there is meaningful articulation with the help of the actuators in the mouth. The articulation and resonance structures of the mouth and nasal cavities are involved in this process. The larynx shown in figure is specially adapted to act as a vibrator. As we already said, with the movement of the vocal cords, you can see this. This is the diagram here. You can say there are different cartilages, arytenoid cartilage. Right at the top is the thyroid cartilage. Can you appreciate that? Thyroid cartilage. Then thyroarytenoid muscle, which is attached to the thyroid cartilage, and the then there is thyroid cartilage and this arytenoid cartilage, and there are lateral criticoarytenoid muscles again. देखो पहला नाम जो है ना वो उसकी अटैचमेंट इंसर्जन और ओरिजिन को डिनोट करता है. ठीक है, तो लेटरल क्रिकोएरिटिनॉइड मसल जो है क्रिकोएरिटिनॉइड क्रिकोइड कार्टिलेज और एरिटिनॉइड कार्टिलेज के बीच में ये कनेक्शन है. फिर पोस्टीरियर क्रिकोएरिटिनॉइड मसल दैट इज पोस्टीरियरली प्लेस्ड, एंड ट्रांसवर्स एरिटिनॉइड मसल ये जो दिखाया है. ठीक है, तो ये अब एनाटॉमी आपको मुझसे अच्छी आती है, मुझे अच्छी तरह से पता है, लेकिन आई जस्ट अ लिटिल रिकैप सो दैट वी कैन अंडरस्टैंड द प्रोसेस ऑफ फोनेशन. The vibrating element is the vocal folds, commonly called the vocal cords. The vocal cords protrude from the lateral walls of the larynx toward the center of the glottis. Can anybody tell me the nervous supply to the vocal cords? Yeah, recurrent laryngeal nerve. The vocal cords are supplied by recurrent laryngeal nerve. As we said, there are cerebral cortex centers which help in speech. Through the movement of these vocal cords, the sounds are made. Okay, so they must be supplied with good nervous control. The vocal cords on either side, left and right, is supplied by the recurrent laryngeal nerve, which sets in vibrations into the sound box of the larynx to create sounds. They are stretched and positioned by several specific muscles of the larynx itself. Okay, figure B shows the vocal cords as they are seen when looking into the glottis with the laryngoscope. ये देखते हैं B में, ये देखो. Can you appreciate that? This is the position of the vocal cord in full abduction. This is gentle abduction, and this is intermediate position or a loud whisper, and this is a stage whisper, and this is full phonation. So by changing the length of the vocal cord, when they become approximated or when they become abducted, they can create various sort of sounds. Okay. Okay. During normal breathing, the cords are wide open to allow easy passage of air. During phonation, the cords move together so that passageway of air between them will cause a vibration. The pitch of the vibration is determined mainly by the degree of the stretch of the cords, but also by how tightly the cords are approximated to one another and the mass of their edges. So by just changes in the length of the two vocal cords and approximation and abduction of those vocal cords, because they are attached to various muscles of the larynx and cartilages itself, they can set in vibrations into the sound box of the larynx, and they can be of varying qualities. Okay. Immediately inside each cord is a strong elastic ligament called the vocal ligament. This is attached anteriorly to the large thyroid cartilage, which is the cartilage that projects forward from the anterior surface of the neck and is called the Adam's apple. Posteriorly, the vocal ligament is attached to the vocal processes of two arytenoid cartilages. The thyroid cartilage and the arytenoid cartilages articulate from below with another cartilage, the cricoid cartilage. The whole idea is to set in vibrations in the larynx to the various degrees so that different sounds can be created from this sound box. And to give them meaning, you have to have the help of actuators, which are the structures in your mouth that can give the meaningful speech to those sounds which are created through the sound box. Okay, muscles located within a vocal, that we have done. Also, slips of these muscles within the vocal cords can change the shapes and masses of the vocal cord edges, sharpening them to emit high-pitched sounds and blunting them for the more bass sounds. The bass sound or high-pitched sound, you see, you are now manipulating the quality of the sound. Okay, first thing is to create a sound, then the quality of the sound, then to give it a meaningful speech, meaningful words. You see, there are different languages in the world, okay? And they are all meaningful. They are a specific meaning to those languages, and that is with the help of your CNS. Finally, several other sets of small laryngeal muscles lie between the arytenoid cartilages and the cricoid cartilage, and can rotate these cartilages inward or outward or pull their bases together or apart to give the various configuration of the vocal cord shown in figure B, वो हम अभी देख चुके हैं. So let's combine the articulation and resonance. हमने देख लिया है कि जी phonation कैसे होती है. अब articulation और resonance की बात करते हैं. Three major organs of articulation: lips, tongue, and soft palate. We are all familiar with their movement during speech and other vocalization. The resonators include the mouth, the nose, and associated nasal sinuses, the pharynx, and even the chest cavity. Again, we are all familiar with the resonating qualities of the structure. For instance, the function of the nasal resonators is demonstrated by the change in voice quality when a person has severe cold that blocks the air passages to these resonators. क्या कहते हैं उसका? Sinusitis. Sinusitis में ऐसा हो जाता है. Okay, speech की definitions की अब बात करते हैं थोड़ी सी. Clang associations. These are thoughts connected by having a similar sound rather than meaning, as seen in bipolar disorder. इसमें क्या होता है, patient जो है वो एक similar sound utter कर रहा होता है, but they don't usually mean anything. Like train, brain, rain. अब ये train, brain, rain, they are all similar sounds, but when you combine them together, they don't make any sense. This is called clang speech. It is usually seen in bipolar disorders. The train, brain, rain, they are similar sounds, but they are not meaningful. So This is called clang association. The other type of abnormality, mutism, absence of speech without impaired consciousness. अब ये हमारे हाथ में ये बटन आ गए हैं म्यूट करने वाले, लेकिन this mutism is inherent. Okay, sometimes you will see when people are very frightened, they are conscious, they are awake, but they are unable to speak. You must have noticed that or must have experienced that at one time or the other. So this is called mutism, absence of speech without impaired consciousness or without any CNS abnormality. This is called mutism. So you have clang associations, you have mutism, and then neologism. An inverted word or a new meaning for an established word, the word webinar for a seminar on the web. So this neologism is basically sometimes people invent words. I remember once I watched the movie Ben Hur. It was a classic. And one of my friends, we were together for quite some time. Any good thing that he saw, he said Ben Hur. So this is neologism. You have invented a word that has different meaning or a new meaning. अब फिर इसी तरह से अब seminar on a web is a new word. It's called webinar. That is a seminar on the web. So neologism is this type of speech. So different speech. अभी तो हमने बात की clang associations की. We talk about mutism. We talk about neologism. Pressure of speech. कभी बहुत ज़्यादा हम लोग मतलब stress पे होते हैं, pressure में होते हैं. तो we are saying so many words at a time, rapidly, excessively, continuously. And that speech is due to pressure of thoughts, and sometimes we are unable to, explain ourselves. So this is called pressure of speech. So we have clang association, mutism, neologism, and pressure of speech. Aphasia, loss of speech, total inability to speak is called aphasia. Aphasia relates to abnormalities of language functions, particularly to disorders of expression and comprehension of speech. Causes include the lesions in the categorical hemisphere like thrombosis and embolism of local vessels. It's usually as a result of CVA and trauma. It's not uncommon to have somebody who had a cerebral vascular accident or a brain hemorrhage to lose the ability to speak later on. So this condition is called aphasia. Aphasia is basically the inability to speak. Okay, then there are different classification of aphasia. There are different types of aphasia, and those types include fluent aphasia. Fluent aphasia relates to comprehension. The individuals have difficulty in understanding in spoken or written language, even though their hearing and vision are not impaired. Their speech is fluent due to lesion at Wernicke's area. So they are unable to, there are problems with comprehension. Okay. And they have, when you say problems to comprehension, that means the individuals have difficulty in understanding in spoken or written language. So that is due to lesion at the Wernicke's area. Non-fluent aphasia is expressive aphasia. There is difficulty in expression due to lesions at Broca's area. Broca's area is the speech area. And it's a non-fluent aphasia because there is inability to express. This is why this is also called expressive aphasia. Then we have anomic aphasia. Patient has difficulty in using and understanding words denoting objects due to lesion in angular gyrus. Anomic aphasia mein, what is going on is the patient has a difficulty in using the words which denote objects, or they have the difficulty in understanding the words denoting objects. Supposing अगर उनसे कहा जाए जी ये ship है, so they don't understand. And sometimes they are unable to say ship. They will tell you there is something in the water, and you know, common thing बच्चे को भी पता होता है क्या होता है ship. But they are not using that word. So these are usually due to lesion in the angular gyrus. Sometimes they're not getting the word to use that, or sometimes they are not understanding. And it is always related to the objects. So they are unable to name the objects or to understand those objects, although they know what they are, but they are unable to name it. This is called anomic aphasia. So we have different type of aphasia, fluent aphasia. Okay, it is to do with comprehension in understanding and in speaking due to lesion at the Wernicke's area. We have non-fluent aphasia. This is called expressive aphasia. And this is due to difficulty in expression due to Broca's lesion. And when there is a lesion at the angular gyrus, there is anomic aphasia. Anomic aphasia is difficulty in using a word to denote an object or to understand a word denoting an object. So this is anomic aphasia, and this is due to lesion at the angular gyrus. Okay, vocal injury, you know, in old days, you know, when the thyroid surgery was performed, it usually result into vocal cord injury. That was about, you know, 3-4 decades ago. But now the surgeons are really smart. And I was watching as a student, my professor performing a thyroid surgery, and somebody asked, "Sir, where is the vocal cord?" So he just used the back of the scalpel and lift the vocal cord. Can you see it now? So if you can see it that clearly, you cannot injure it. I know that. I'm sure. So it's fairly uncommon to have a vocal cord injury as a result of surgery. Okay? But it is very easy to injure the vocal cord when you are performing the surgeries on the neck regions. But as I told you, I gave you the example of a surgeon. They are smart now. Forceful singing, yelling, screaming, loud talking can cause the vocal cords to hit very hard and result in injury to the cord. These are forms of vocal abuse. It happens. It happens. वो जो लीडर लोग नारे लगा रहे होते हैं बड़े बड़े इलेक्शन के ज़माने में खड़े होकर जोर जोर से, उसके बाद उनकी वॉइस हॉर्स हो जाती है, you know, that is temporary, that is reversible. ठीक है? So the forceful use of the vocal cord, either by singing, yelling, screaming, loud talking, narabazi, ठीक है? It causes the vocal cords to hit very hard and result in injury to the cords. Okay, excessive amounts of phonating, singing, talking can also lead to injury. This is called vocal overuse. That vocal use, and they are all luckily reversible, you know. When you give it a rest, they recover and you regain your ability to speak. Nodules, polyps, laryngitis, and hemorrhage of the cords are possible effect of such vocal abuse. So the smoking also has dramatic effects on the larynx. It can cause all kind of problems, starting from the oropharynx to the larynx, then to the lungs, cardiovascular system, metabolic disorders, CA lung, so many abnormalities. We strongly condemn smoking, and we are part of the anti-smoking campaign, all of us. Okay, I think that's it for this session. If you have any questions, I'll be glad to answer. Okay, one by one. Hello.
Sir, can I help you?
Yeah, okay.
Sir, this is Furqan.
Ji Furqan.
Sir, can I help you?
Yeah, Furqan, okay. I was asking, I think my students are mute right now.
सर आप ये स्टूडेंट के नाम पे कर्सर लेकर जाइए, वहां पर अनम्यूट का एक बटन आएगा, वो क्लिक कर दीजिए तो अनम्यूट हो जाएगी वो स्पेसिफिक वो स्टूडेंट.
ओके, ठीक है. Okay.
Zunaira, kindly unmute yourself.
Hello. अगर इनको एक साथ अनम्यूट करना चाहें तो फुरकान.
सर अनम्यूट का बटन होगा, जो लिस्ट आ रही है ना पार्टिसिपेंट्स की, वहां पर एक अनम्यूट ऑल का बटन होगा नीचे. पार्टिसिपेंट्स की लिस्ट है सर, उस लिस्ट के नीचे अनम्यूट ऑल का बटन होगा.
अच्छा जी, ये
Hello, sir. Assalamu alaikum. Hello. Sir, can you hear me? Hello.
okay, unmute. I'm doing. Hello, students. I can hear you now. Anybody has any questions?
Please ask question one by one. Anybody have a question? Please raise your hand and ask question one by one. Zunaira, please ask your question.
तुम्हारी आवाज
Zunaira, can you hear me?
I can hear your sound in the background, but I tell you one thing. मैंने ये पूरी की पूरी जो है ना आपको एडमोडो पे अपलोड की है कल से. You can go through it and there is one single MCQ followed by that. तो उसको असाइनमेंट को आप सबमिट कर दो आज 2 बजे से पहले. ठीक है.
अस्सलाम वालेकुम सर.
वालेकुम अस्सलाम.
मुझे आपसे इस पे बात करनी थी असाइनमेंट पे. जो एमसीक्यूज था, मतलब देयर वाज जस्ट वन एमसीक्यू, उसमें आंसर ए और सी दोनों है ना?
ये बेटा आपको देखना पड़ेगा. देखो आपको जब दो आपको आंसर सही लग रहे हैं ना, तो यू हैव टू सी विच इज मोर राइट. यू सी ऑल आंसर्स कुड बी राइट. दिस इज द ब्यूटी ऑफ वन बेस्ट. यू विल सी विच वन इज मोर राइट. ओके, ये तो क्विज है ना, मतलब इसमें तो आपको आंसर नहीं बताना चाहता मैं, तो आई वांट टू सी योर रिस्पॉन्स. तो आप उसमें से बस उसको टिक करो जो आपको सबसे ज्यादा अप्रोप्रिएट लग रहा है. ऑल आंसर्स में भी राइट. यही वन बेस्ट की ब्यूटी है. एक्चुअल वन बेस्ट होता है यही. तो एक ही तो डाला है मैंने, उस पर थोड़ा सा दिमाग लड़ाओ.
यस सर, थैंक यू.
Anybody else?
Yes, sir. I do have a question.
Okay, beta. Furqan.
Yes, sir. The question is, कि we provided the same system and all that phonation और ये सब phenomena same होता है और हम same sounds भी produce करते हैं. But what is that feature? What is that specific thing which make us distinguish between the voices? में आपकी अपनी आवाज है, मेरी अपनी आवाज है. How? What is that part? What is that? I cannot explain that thing कि वो क्या है जिससे हमारी आवाज अलग अलग होती है.
जी बहुत ये आपने बहुत अच्छा सवाल किया फुरकान. आई एम ग्लैड दैट यू आस्क्ड दैट क्वेश्चन. देखो इसमें देयर आर स्लाइट वेरिएशन इन द larynx or the sound box, or that gives you the specific characteristics of those sounds. So yet we have hundreds of thousands or millions of thousands of voices. यही तो ब्यूटी है. ये दिस इज व्हाट हैज क्रिएटेड बाय अल्लाह सुब्हानहू व तआला. इतनी दुनिया में इतनी मखलूक अल्लाह ताला की, दो एक जैसे होते हैं. बिल्कुल इसी तरह से ये लैरिंक्स में स्लाइड, फिर वोकल कॉर्ड की लेंथ और उसकी डिस्ट्रीब्यूशन में स्लाइट वेरिएशन होती हैं, माइन्यूट माइक्रोस्कोपिक, दैट गिव्स यू द कैरेक्टरिस्टिक tone and timbre to your voice. But with training you can modify them a lot. Some people have this ability, unique ability, to make different sounds at a time. आपने देखा होगा कोई टीवी आर्टिस्ट भी हैं, मुख्तलिफ लोगों की आवाज़ें बड़े मज़े से बना लेते हैं. So that is by the use of the sound box and the vocal cords. और जो inherent है वो उसकी अपनी वॉइस या साउंड जो है वो उसकी अपनी कैरेक्टरिस्टिक होती है. So these are like minute microscopic variations in the larynx and the vocal cords that gives us characteristic sounds. Anybody else? Okay students, go through the presentation. फिर भी कोई चीज हो, you can ask me anytime. लिख के पूछ लो, ऐसे पूछ लो. Submit your assignment today. Okay. Take care.
Thank you, sir.
Thank you, sir.
Thank you, sir.
ख्याल रखो, ठीक है. अल्लाह से डरो, कोरोना से मत डरो.
अल्लाह हाफिज.
Take also
Allah Hafiz, sir.
take care.